your testosterone levels show more than a 10x increase from 14 nanograms per deciliter to 168 nanograms per deciliter.
Honestly, you're the reason why I track it. I have been with an endocrinologist for several years. I had a full hysterectomy um, almost 20 years ago, about 18 years ago, which put me into surgical menopause at the time. And I went on bioidentical hormone creams. That was with a functional medicine doctor. And then I went with the endocrinologist, and she's been tracking, she does my blood work, very frequently. I'm very sensitive to it. It's a double-edged sword from everything that you read about hormone replacement therapy and whatnot, the pros and the cons. I have tried getting off of it, and it has not served me well. So I stay on a very, very low dosage of it just to help me maintain myself and my sanity. I started tracking it. I did my blood work last October 2023, and that showed the testosterone level at 14. And doing the cold therapy, I started that in December 2023. And I'll just share with you for a minute why I started it, because it's not only serving my hormone levels, but it's also serving my mental health. So in November, a week before my 60th birthday, my mom unexpectedly passed away on her 94th birthday, which was absolutely beautiful that, she passed on her birthday and her family was with her, but sad nonetheless. 5 days after that, one of my closest girlfriends lost her life to mental health. And that like totally rocked my world because I had been very close to her and also trying to help her the best I could with her mental health. And that all of that happened. And then 2 days later, I turned 60. And I was just kind of going downhill. I was really depressed. I was really anxious, having a hard time processing it all. And I thought, I need to do something for myself. I know enough now, as a teacher and facilitator to know when I need to access my own toolbox. And I had been doing the infrared sauna. I have an infrared sauna at my house, but I had kind of, been reading a little bit about cold therapy, and I thought, I hate the cold. I live in Florida. It's really not something that's my jam, but I had been seeing a lot of it on social media. So I thought, you know what? I'm going to take, the cold plunge and actually start doing it. And I started it in early December. And the most immediate effects, I would say, would be the mental health component. The mental component of challenging myself every day, showing up for myself every day, doing something hard for myself every day, getting in there, sticking with it, trying to progressively get colder, trying to progressively do it longer. And that in and itself was really cool, but it also boosted my mood because of all the happy hormones it releases. It also eased my anxiety. Once you can get past that first 30 seconds or minute and you can just settle into your breath, it really almost feels like you're in a little cocoon and you feel safe and you feel in control. At first you don't, but then you do. And as a meditation teacher, I know the whole concept of parasympathetic, sympathetic nervous system and throwing myself into that fight flight response, but then using the tool of the breath and my mind, and I can do this. It really was very profound. So I did it, I think it was like 40 days in a row, and then I had to go do a retreat. But those 40 days was super impactful, powerful, and my body never felt better. I have a lot of arthritis, and this is something that I hadn't even talked to you about. I have degenerative osteoarthritis in my thumb joints. So I had also last year had thumb surgery on my right thumb, which took me out for 6 months of yoga and golf, which are 2 of my passions. Then in January, so my mom and friend passed in November, started doing the cold therapy in December. January, I had to go get my left hand done, which then took me out another, well, until now. I can now start kind of using it. So I have had injections in my back and my shoulder. Everything feels amazing, like so good.
You are the first woman to send me lab reports of her testosterone before she started doing ice baths and exercise, and then after she started doing ice baths and exercise. And your testosterone levels show more than a 10x increase from 14 nanograms per deciliter to 168 nanograms per deciliter. You were saying that you had a hysterectomy. If you've gone from 14 nanograms per deciliter to 168 nanograms per deciliter, and you haven't changed your hormone replacement therapy dose, then I'm going, where is the testosterone
Right.
coming from?
And that's why I reached out to you, because I had been reading the research that you've been doing and showing in men and the increase in testosterone. So I just had in the back of my own mind, I'm going to check that the next time I do my hormone panel. And I had done it last week and I was like, wow. And the only thing that was different was the cold therapy. That was it. And now my endocrinologist, she messaged me and she like, stop the testosterone now. Um, and then I also sent you yesterday, because I've been getting the results trickling in. My estrogen levels also had a, fairly significant bump as well. So, it's just going to be super cool when I meet with her on Monday to see, what all the levels are. I have Hashimoto's. I've also read that you have found that people have been able to reverse or cure their Hashimoto's. So I'm hopeful for that. So I'm really excited. I know I have a very sensitive system and I am not one to want to take medication. So anything I can do to avoid it, I'll do. I work hard at eating clean. I work hard on my sleep hygiene. I don't work hard, I shouldn't say that, on my stress levels. I'm cognizant, I'm aware of it all. Am I perfect? No. But I do try to do the best that I can to maintain myself. It's at 60 years old, I want to not only extend my life. I don't have the idea of extending it to, infinity and beyond, but I want to be able to feel good in the body I have for as long as I'm here. I want to be driving a Bentley, not an old jalopy. So whatever I can do to kind of live in that wellness state, and we're not guaranteed anything, right? But I want to try to do the best that I can do to keep myself feeling the best that I can. And, I have pre existing conditions, with the degenerative arthritis. Part of that, I got a big history lesson from my hand surgeon, because when I got the diagnosis last June and had to get the surgery and be out of two of my, extreme passions, golf and yoga, that was a hard pill to swallow. And I'm doubting myself, second guessing myself, what could I do wrong? And she assured me that, it was a genetic condition. It's just, and you probably have heard the term, and they've said it here at the biohacking conference this weekend: genetics loads the gun, lifestyle pulls the trigger. So, I have been very active athlete all my life, owned a gym, like very, very active, very um into yoga, the primarily the past 15 years. And when you do a lot of yoga, your hands become your second set of feet. So you're overusing your hands and the pressure. When you play golf, you're putting a lot of pressure on your hands. So I think that's why it displayed itself in my hands. Whereas my siblings have had a knee replacement, a hip replacement, back issues. But learning all that I'm learning through biohacking, through cold therapy, all the inflammation and whatnot, anything I can do to decrease the inflammation, I'll try my hardest.
then you are like a lot of other people who have found that a regular practice of cold plunge therapy is going to relieve a chronic autoimmune condition, whether that's
Hmm.
Hashimoto's or arthritis. If it manifests as chronic pain and inflammation, people are finding that when they practice cold plunge therapy, it doesn't have to be every day, but regularly, they get relief from those symptoms, freedom of movement, less joint pain, those kinds of things. Is that what you're experiencing?
Oh my gosh, 100%. My back, again, both yoga and golf, it puts a tremendous amount of stress on your back. And I've had back injections. I saw I saw my back surgeon not long ago, and I went up to him and I said, I have found out how to put you out of business. And he's like, what? And I go, well, cold water therapy. I don't need to come to you anymore and get the injections and do all that. So
And what was his
um
reaction?
I mean, he just said, "Really? It's helped that much?" And I said, "Yeah, 100%." Like, I hate admitting this. I would have a hard time in the morning when I'd get out of bed, kind of standing up straight and then bending over to brush my teeth. Like, I felt like the Tin Man where I had to kind of give myself 5 or 10 minutes to lube my body up to get moving, but now I can pretty much honestly get out of bed, I would say pain-free.
That's fantastic.
Yeah.
But but Pam, sometimes women will write to me and they'll say, "Well, I don't want to do ice baths because I don't want all that testosterone." Here you are, without changing your dose, your testosterone has leapt. And it's possible because testosterone is converted into estrogen and other things. Your body processes testosterone. It's possible that your body has changed its own testosterone set point by leaving testosterone in your bloodstream instead of reprocessing it into other things. But you also checked your estrogen, which was a really good thing because you went from 20 to 32. It's not that your super high level of testosterone has also increased your estrogen. It's just gone up a little bit. And
Mhm.
some women would say, but I don't want to grow a beard. I mean, look at you. You're very feminine. You're beautiful. You're aging well. You're probably proud of yourself. And do you have any misgivings about having a testosterone level that high?
No, not at all, and it's funny you say that because and I didn't make the connection, I don't know if it's true or not, but my hairdresser, the last time I was there, she's like, "Your hair's so thick, like, it feels different, what are you doing different?" And I just thought maybe it's the collagen I'm taking or something, but no, I don't feel masculine, I feel fit, I feel strong, um, I can hit the golf ball over 220 when I drive the golf ball. I mean, I hit further than a lot of women my age. And no, I don't have a beard. I'm not shaving. There's nothing, that I would say is frightening or discouraging for me at this point. Now, I am stopping my cream. So it'll be interesting, in another couple of months to see what happens, how I feel, what happens to my levels. They, whatever. I'm going to keep doing what I'm doing. With the sauna and the cold, the heat and the cold, and all the other cool biohacking things that I've been learning about.
The men who report that they've pre-cooled their exercise, they've done ice bath, they followed up with exercise. The men who report that they've seen a big testosterone boost all tell me that they feel fantastic. Do you feel fantastic?
I do. I do. I still have a little bit, and it's probably maybe the Hashimoto's. I do get a little fatigued. I get a little bit tired in the afternoons. But I do feel fantastic. I mentally, I'm so much clearer, joyful, focused. I don't have the anxiety that I have had in the past. I don't have the depression that I've had in the past. I do find that getting in that cold water, it kind of melts everything away.
Yeah.
As strange as it is, and don't get me wrong, I don't like it. I stand over it, and I'm like, I have to kind of psych myself into it. But knowing how good I feel, and it's so funny because it happened when I started teaching meditation and happened when I started teaching yoga, and now it happens when I start preaching about cold water. people are like, oh my God, I don't want to do that. I can't meditate because I can't sit still. I can't do yoga because I'm not flexible. I can't get in the cold water because I don't like cold. Okay, well, we all have to start somewhere, right? And it's just learning how to condition yourself and train yourself, you know, that you can do hard things, you can get in that cold wet water. The benefits are so immense. No, I feel great.
About what temperature is the water that you're using?
46 degrees.
Okay. By
So
my
it's not
standards,
like
not
extreme.
even that cold.
Oh my God, stop. I know, but it is colder than a lot of people I know. There are a lot of
Yeah.
women that I know. And I just, I guess I can continue to try to work my way down, but I also look at it like if I'm getting such great benefits, why would I need to? Maybe you can answer that for me.
No, it's working. It's doing everything for you that you want it to be doing. Most of the medical doctors are just disbelief
I guess so. I guess so. But how can you debunk the blood work? Like it
Yep.
is what it is. And you know, I I don't mind when people think I'm a little nuts or a little woo woo, because I know what I know and I know how I feel. And, it was the same with meditation. And now there's, journals and doctors and scientists and researchers all saying that meditation changes the structure of your brain, neuroplasticity. So I don't mind. I don't mind being a little weird.
Good. And in 20 years, they'll all wonder what took them so long to come around to your way of doing it.
Yeah, exactly.
It's terrific. Pam, thanks. I'm looking forward to hearing from you in a few more days.
I'll be in touch. Thank you. Thanks for your
Thank you.
time. It was fun talking to you.
It's a pleasure. Bye
All
bye.
right. Bye.